Guys, welcome back to the channel. Let's start the topic impaction and continue it. Today we will dealing the general steps in surgery and different kinds of incision when we have third molar impaction. Okay, if you have any queries, please go and in comment section and ask. Let's start. General steps in surgery. First and foremost, we have to take the history of the patient. It is a very crucial step. Get knowledge about medical history, past dental history before starting any surgery. Okay, it's very important to get about the medical history if he or she is suffering from any endocrine disorders, hematological disorders, or any dysfunctions, and past dental history. How was the experience in past, or if he has gone through any allergy, anything. So this part is very important before starting any patient or any surgery. Then second is patient preparation. Getting the patient mentally prepared, explaining him or her about the surgery and the procedure step by step. This is also very important. In pediatric patient we call it conditioning. In adult patient we call it patient preparation. Patient should know what you are going to do and how much time it will take and what are the steps. Okay, general status and patients of patient and patient's health, which we will get through history taking. Arranging the instrument tray, taking all the blood reports and taking consent. Consent is again a very important thing. Now, painting and draping of the patient. Radiological assessment we have learned. It will help us to guide how will the procedure go. Anesthesia, incision and reflection of mucoperiosteal flap. This is full thickness flap, so it allows the good access. Removal of bone to allow the delivery. We'll be dealing all these in detail. Then removal of tooth, sectioning as per in the case, wound debridement and wound closure. These are the 10 basic steps for any impaction. Okay, now what happened in radiological assessment? We can go for IOPA, OPG or CBCT. CBCT in case where tooth is in close relation to the intraalveolar canal. Okay, it allowed to proceed for surgery whether sanctioning of the tooth is required and tell us about the type, class and position of impacted molar and its structure in close relation. This is why the radiological assessment is very important. Now anesthesia, it can be local or general. General anesthesia in case which have number of teeth more, means one or more tooth are impacted, or suppose all four wisdom tooth have to be removed. Complexity of the case, example close to the deeper vital structure like nerve or sinus. This will done through this. When we will go for radiological assessment, we will assess that it will go for GA or LA. Okay, non-cooperative patient, extremely anxious patient, mentally retarded. Oh, this is the history taking part and patient preparation part. We'll know this. And some medical condition, bleeding disorder, uncontrolled diabetes. ये भी जब history taking करेंगे तब तो फ्रॉम, इसलिए हर एक स्टेप सर्जरी में फ्रॉम लाइन टू लाइन इट इज़ वेरी इंपॉर्टेंट, फ्रॉम हिस्ट्री टेकिंग टू रेडियोलॉजिकल असेसमेंट, because all this will determine what type of surgery we are going to do, what type of anesthesia we are going to give. Okay, now coming to incision and flap design. Okay, we'll deal this, and and in next class we'll deal with the various techniques to remove. Okay, incision and flap design. Envelope incision, it is an elevated from horizontal linear incision. It is around gingival margin. It is most commonly used. No vertical incision is given in envelope incision, only this. This is the envelope incision. See, it is around the gingival margin. No vertical incision is given. It is an elevated incision from horizontal linear incision. Okay, this is the horizontal linear incision. The envelope incision is an elevated, or it is the flap that is elevated. Envelope flap is an elevated flap from a horizontal linear incision around the gingival margin. Take it this way. Okay, envelope flap is a elevated flap from a horizontal linear incision around the gingival margin, okay, with no vertical incision. It extends from the posterior margin of the impacted tooth till the level of first molar. Posterior margin of the impacted tooth till the level of first molar. Okay. Posterior end of the incision is directed buccally on external oblique ridge. It is directed buccally. Okay. Now, for greater access, a releasing incision is given in the anterior most part of the incision, which create a triangular flap. Okay. ये एनवेलप फ्लैप हो गया, ये इधर से हॉरिजॉन्टल और ये ऐसे ओपन हुआ, ये फ्लैप हो गया पूरा. ओके. और जब हम एंटीरियर में एक रिलीजिंग इंसिजन देंगे तो दिस विल बिकम अ ट्राइंगुलर फ्लैप. दिस इज गिवन, अ रिलीजिंग इंसिजन इज गिवन फॉर ग्रेटर एक्सेस. ओके. तो वी हैव डन विद एनवेलप इंसिजन एंड फ्लैप एंड ट्राइंगुलर फ्लैप. नाउ एल शेप इंसिजन. सेकेंड मोलर paramarginal flap. It is a paramarginal flap. This was a gingival margin, marginal flap around the gingival margin. This is paramarginal flap. Okay, paramarginal margin idhar hai and this is paramarginal flap with the vestibular extension, with the vestibular extension. So it is the L-shaped flap. Okay, there is also a bayonet shaped flap and a buccal extension flap. Bayonet shaped flap is in the second molar sulcus incision. In the second sulcus of the second molar, we give a incision with a vestibular extension. Just like L-shaped flap, a bayonet flap is there. Okay. Now coming to two most important incision, that is classical Terence Watts incision and modified Watts incision. These two are most commonly used incision during third molar impaction. Okay. Let's start. Watts incision. In both Watts and classical Terence Watts and modified Watts incision, the total length of incision is around 25.4 mm. Okay. Incision begins at the point that lies approximately 6 mm to 6.4 mm below the gingival margin in the buccal sulcus. Okay. It begins at the point that lie approximately 6 mm to 6.4 mm below the gingival margin. Okay, it is below the gingival margin in the buccal sulcus. Where? In the buccal sulcus. And extend upward in a oblique fashion. Okay, it extend upward in a oblique fashion. Anteriorly to the junction of middle and posterior third of second molar and distobuccal line of second molar. Okay, this is the distobuccal line of second molar. This is the vertical incision. Yeah, vertical releasing. This is called vertical releasing. This is called tailing of incision. This is vertical releasing. So in word incision, it is at the distobuccal line angle of second molar. Okay, and in modified Watts incision, it is at distobuccal line of the first molar. In Watts, it is distobuccal line of the second molar. In modified Watts, it is distobuccal line of the first molar. Okay, this is vertical releasing. Now, cervically behind the tooth to posterior surface, taken back laterally, it goes laterally behind posteriorly. Okay, and in final continuation penetrating the cheek mucosa. Okay, in final continuation by penetrating the cheek mucosa. This is called tailing. This is 2 to 3 mm. Now modified Watts, I have told already, vertical releasing is at distobuccal line of the first molar. In case of deeply impacted tooth where accessibility and visibility is much more needed. Okay, there we give modified Watts incision. Okay class, that's all for today. See in next class. तब तक के लिए like, share and subscribe. Do comment the question you need to ask.